Hi, I'm Susan Hogeland. I'm Executive Vice President of the California Academy of Family Physicians, and I'd like to tell you a little bit about what we've been doing on your behalf and on behalf of your patients over the past week. On Monday, Dr. Joan Rubenstein from Fresno, California, who's on our board of directors, traveled from Fresno to Sacramento to participate in a stakeholder group on Medi-Cal presumptive eligibility. Our lobbyist, Tom Riley, was also at the stakeholder meeting with Dr. Rubenstein, and we want to thank Dr. Rubenstein very much for taking a day out of her busy practice to be there on your behalf. On Tuesday, Dr. Ron LeBougan traveled from San Francisco to Sacramento to participate in a legislative hearing about the ability of nurse practitioners in their first 6 months of practice to furnish drugs. We're very grateful to Dr. LeBougan also for being in Sacramento on your behalf. We've been dealing with an issue around the mammography language for notification of patients who have dense breast tissue. We've been working with a coalition of other providers to try to figure out how to make this legislation a little bit more palatable to family physicians and others, and to serve patients better. So what we're looking for is more of an evidence basis for requiring such a notification, and if we fail to do that, to at least make the language in the notification a little bit more accurate and a little less concerning to patients who receive it. We are also looking at the issue of dual eligibility payment. That is part of the budget process, and Friday is the deadline for the delivery of the budget from the legislature to the governor, and legislators have changed the language having to do with how dual eligibles are paid for. We issued a strong legislative alert to our key contacts yesterday to get their participation in contacting legislators to provide different language that will ensure that patients have better access to care and that family physicians and others are fairly paid for those services. Last week, Leah Newkirk, your Director of Health Policy, and I had two very exciting meetings with health plans, and that's not something you hear very often. Blue Shield of California is offering a new product that is what they term value-based insurance, and it has a couple of features that we liked very much. One is that it rewards patients who get appropriate primary and preventive care services by not assessing copays and deductibles to them under their plan. The other piece of it is that it encourages family physicians who have patient-centered medical home recognition and skills to provide services to the patients that Blue Shield has in 6 top cost-intensive conditions, and provide some rewards for doing that. We had a similar conversation with folks from WellPoint and Anthem, who are also coming out with a new product that rewards primary care physicians who have patient-centered medical home recognition. At the same time, we read in the New York Times that United Healthcare is going to continue some of the features that were required of it under the Patient Protection and Affordable Care Act, whether or not the Supreme Court upholds all or some of the legislation. That would include the coverage up until age 26 for children of people with insurance coverage, and other features that we're very pleased about. So we think this is a good trend and a good direction, and I think it bodes very well for the encouragement of family physicians and others to become patient-centered medical homes. So that's it for now. Thank you very much for listening. I'll talk with you next week. Bye-bye.